All right, welcome everyone. My name is Johanna Bergen and I'm the Executive Director of Youth Move National and one of the co-facilitators for the Transitions Learning Community. Today is our second convening of the learning community and we're really excited that you all are here. The intention of this time is for us to learn and grow together in our support of young adults of transition age in the communities across the country. I'm joined today by several of our co-hosts, including Gwen White, Shannon Robshaw, and Bree Maselli, and you'll hear their voices throughout today's webinar. We are going to take a brief moment to thank our co-hosts of this TA Center, of this Transition Learning Community, which include the Now is the Time TA Center, as well as the TA Network. And we welcome all of the System of Care and Healthy Transition grantees that are joining us today. We would like to hear a little bit more about who you are so that we know our comments and thoughts today meet the needs of your communities and your roles. So I have a couple of polling questions. The first polling question will come up on your screen and we ask you to select the best fit answer. So the first question is, my organization can best be described as, and then go ahead and pick the best match from the list. We'll give everybody about 50 seconds to do this. All right, this is great. Thank you so much. We have a wide variety of responses from family organizations to mental health agencies, child welfare agencies, etc. Great. Awesome. It would be helpful if you did select other, if you could go ahead and let us know in the comment box what type of organization you're with so we can capture that in a future poll. All right, great. And 10 more seconds to log your response in. Okay, cool. Colin, can we go to the second polling question? And this question is about will be about your role. So again, we all wear many hats, but pick the option that best describes your role in the work of helping young adults of transition age. And again, if you go ahead and select other, use the chat box to let us know what your work is and your role. Excellent, great. I love the specificity, Erin. Thank you. Perfect. And just a few more seconds to log your response to this question. Okay, great. Thank you. And again, we've got a diverse group of folks on the phone today, so I'm excited for this conversation. We can go ahead and close that poll. All right. And one more thank you to the hosts we have today. And I am excited to turn the first portion of our discussion over to Bree Maselli. And we will hear first from Bree and then have a discussion period.
Great. Thank you, Johanna. So as we continue as leaders and advocates within the mental health field, we continue to try to expand services and supports to appropriately meet the needs of transition age youth, and we often tend to struggle with how to engage young adults appropriately in traditional services that are currently in place. Unfortunately, as a system, we often make the assumption that young adults will just naturally transition into an adult mental health system, and the more we continue to do the work is that the continuity of mental health services is important, but what is most important is helping young adults successfully transition into adulthood. And that may mean a portion of involvement within formalized services, but for the bulk, it may be just being successful in adulthood. Unfortunately, what we tend to see as a systems perspective is as engagement, we tend to see the burden on the participant. And so we always are thinking about disengagement. Why did they choose not to come? Why aren't they coming? Or they're not responsible enough to come. And we tend to kind of make up these assumptions on what may be causing young people to participate and engage with what the system and or community is offering to help them in their transition years, as well as assuming that it's the individual's kind of decision to participate or not participate. And so when we think about engagement from an individual perspective, we really need to understand how the system is designed, the processes that are in place to help a young person access the services and or be connected to community, as well as the settings that young adults tend to interact in daily as well as spend time. Engagement is not a linear process. It's a really fluid process, and it's really based on individualized needs, and it is not a distinctive kind of outcome that is easy to measure. So when you think about engagement, it's not as simple as checking the box that they came, but really understanding what promoted their engagement and how are you tracking and understanding what is getting them to come and participate and to participate in ways that really matter to them. So to better understand why young adults may disengage from services and supports that are most beneficial to them during transition age, and reflecting on what might be most appropriate ways to engage young adults, I think it's really important that we pause as systems leaders and advocates and really think about two perspectives to reflect our work on. And one is the developmental approach of young adults and how developmentally where they are may impact how prepared they are to transition into adulthood and access and engage formally in services. So if you think about the developmental approach is that what makes young people want to ask for help with something versus what makes them think that they can handle it on their own. That really is a decision-making thought process that takes a little bit of time, and as well as some kind of skilled kind of pre-contemplation kind of thought that they individually need to kind of take ownership of. The second is kind of thinking about the social approaches that lend to one, kind of building their identity on kind of who they are, how they manage their mental health, and what processes they're used to, and that social structure that might influence one's approach. So oftentimes the social approach may impact if someone will engage or not engage due to the social factors that might be hindering engagement. For example, we often see in the field for transition age youth a social approach when we think about those social influence and infrastructure components that are in place. It's for young adults who may be in child welfare. I have heard from young adults that as they transition out of the child welfare system, that they struggle without the support of the system to understand how they should access basic things in life, including how to make basic decisions, because there was always a service provider making the decisions for them. So for them, the social approach is that they're used to the system informing their decisions and being there to guide them during the times that they might not developmentally kind of know what is best. The other approach with child welfare is sometimes we see that young adults grow up in the system. The minute they're old enough to get out, they want to run as far away from formalized services as possible. And that is based on kind of that social construct of how they've come to engage within the system and how that process was positive and or negative. So when we think of disengagement, we have to think of these developmental factors of, are they ready to ask for help? Do they know what they might need help with? And how do we build them up to be confident to then seek out asking that question of a peer, an adult ally, a formalized system, at the same time as understanding the barriers within community or social dynamics that might hinder that. It's really hard for young adults to really actively engage in mental health services formally when they're really struggling with basic social determinants of health. So if they are lacking employment, income, they are lacking housing, they can't find a job, they're hungry, it's really hard for them to kind of think about their mental health care first, because they're really thinking about their immediate kind of needs of I can't think about my mental health treatment or services or identifying goals when I don't know where I'm sleeping tonight. So mental health and formalized systems are not always the first kind of engagement points for youth. Oftentimes it tends to be their social groups. So it really depends. It really depends on who's influencing them around, and if they have a struggle, who's helping them get connected or process through that maybe you should ask for some help, or it seems like things are a little challenging for you. And so understanding those kind of factors might help communities better design service systems for this population, because they're going to take into consideration that the young person is not going to get into services first and then get a job and then get a house, that they might need a meal first. They might need other things in place first, and when those kind of life factors have stabilized a little bit, then formalized mental health services might make sense. And I think that that's crucial for this population when we think about formalized services as well as offering opportunities for more informal access to programming. So it might not always be a structured treatment and or intervention, but it might be low barrier programming that can really make a difference to at least keep them getting engaged until they realize that they have a higher level of need that might be more appropriate through services. So when we think about promoting engagement, it really comes down to young people who feel valued. Individually, we want them to feel value, but we also need them to see value in participation. So if they're participating and engaging, they need to feel as if they have a place to participate. They need to feel as if their participation matters in the program, that they have something to contribute, and that they have the ability to learn skills to participate in whatever ways feel appropriate for them. Not all young adults will want to participate at the same capacity, but yet we have to be there to meet them where they're at and still offer them opportunities to continue to learn and grow. And then feeling connected to a community, family, friends is really crucial. Oftentimes, the system is not always there for young adults, and nor should the only caring adults around them be paid staff. So really helping them rebuild positive relationships with caregivers, have a sense of community, and that might be, connecting to church or finding a group to connect with so that when services are not open, they still have other folks that they can call. And then understanding engagement, measuring engagement will look different for each individual and for each program. And how, as a system, you are measuring engagement matters on how you're defining it. And I think it's really crucial to define what engagement looks like for this population with actually involving them in the process, so that you're measuring engagement, but you're measuring it at a variety of different levels, so that it doesn't show that the young person is not engaged or not being successful, but they're just engaged in different ways. And then also capturing what they're engaged in when they're outside of the formal clinical relationship, like what do they like to do, and that's a way to continue to make sure that they're feeling connected to the community, friends, and family. So in the article that we provided you guys, the toolkit that really looked at factors that promote engagement, as well as some reflective pieces to think about what might be promoting disengagement. There is the employing participatory approach to reduce engagement. And this graphic is one that they developed, but I think it fits really nicely with the system of care philosophy and the healthy transition approach, is that youth and young adults need to be engaged and participate in all levels of the service design if we really want to build a responsive system. And so you'll see in the first box, policy and practice that impacts on the social determinants. So really thinking about the policies and practices that you have in place for clinical practice, but also do they take into consideration those social determinants of health, community and social context, and basic needs. Thinking about the role that young adults play in promotion and prevention. So young people talk to young people. That's where they get their information. They get their information through technology. And so how do you promote and do prevention work around hard-to-reach populations as it relates to accessing mental health services? And how are you engaging young people in identifying what those strategies are? Also looking at the service and models and treatment. So understanding the population and what they need, and then how do you design the service array to really complement where young people are. And not all young people are going to need a really intensive team-based planning process, where others might need more flexibility, where it feels more like coaching versus therapy. And so thinking about what's important to young people when they're engaging in these formalized services. And then also thinking about within those service models, what is the treatment models, but what can also be the informal peer-to-peer connections or skill-building, leadership, and competency-building program aspects that you'd be able to engage. So as a community, finding ways to continuously assess where are you at as it pertains to these elements is crucial. Thinking about how you design satisfaction surveys, asking young people who participate in low-barrier programming what's making them come to the program. Is it that it's skill building? Is it that you offer a meal? What is it that's keeping them engaged? And then engaging them in what messages of success might you want to share with others to attract others who need to get connected. One of the things that through meaningful youth and young adult engagement, that over the years of being a youth coordinator and a young adult who accessed services, was really understanding that if you can establish an ongoing relationship with the system and or the agency that is not always about one-on-one treatment, that gives you other ways to participate within the organization or within the work really helps you stay connected when your treatment and services might be over. And then we know with transition age young people, things are going to pop up along the way, and you might need to get reconnected to the system. But if you have positive relationships and positive experiences in the agency that was helping you, it's often easier to go back. You have a place to go. You have established relationships. You know what to expect. So understanding that young people may participate and be engaged in one aspect of your programming, but yet when they feel that things are going well, they might disengage. But as long as you keep that relationship intact and always keep the door open for them, they're more likely when things start to get rocky again and they need more help to want to go back to your agency. And so always thinking about keeping those communication pathways and those options always open, that you're there for support, is really crucial. So you all received some resources and some homework that we had asked you all to kind of review the resources, do a little bit of reflection so that we can participate in a little bit of a peer-to-peer sharing and discussion. So on the slide, you'll see the first kind of homework discussion. And we have a couple questions here in regards to how are you addressing disengagement factors that are affecting young adults of transition age within your work. And we will open up the lines to have folks kind of chime in. And for those of you that are not able to chime in, you can also use the chat box, and we'll be able to facilitate some back and forth discussion that way. So Gary, if we could open up the lines. So they should be unmuted. So you will just need to unmute your phone, which I believe is *6, if you want to give an example about how you are addressing disengagement for young adults of transition age.
Hello, everybody. My name is Francisco. I'm from the Youth Forward grant here in Lawrence, Massachusetts. And to answer the question, one way that we have tried to curb this disengagement factor is by offering young people rides from our tip facilitators and peer mentors in a way to, because we see that public transportation, either the young people don't want to take it or they just don't have enough money, or their life is too, they live it day by day to the point that it's too, they can't think ahead like that. So we offer them rides to the drop-in that we have available and back home or wherever they go. And we try to implement fun activities that keep everybody engaged. And so that's another way that we try to curb this factor.
Great. So I hear a couple of things there, is that you provide some stability, such as transportation, so that they can have consistent involvement to meet perhaps a transportation need. The other thing I heard is that you have drop-in centers, which drop-in centers tend to be very kind of casual and fluid, so that you can come and go when you need to feel connected and get connected with other young people and or your service provider. So kind of that really kind of easy access, low barrier, that definitely helps with engagement. And then also everyone likes to have fun. So making sure that the program is not always about treatment and goals and reaching your goals, but giving some opportunity for just some pro-social connection and that kind of peer-to-peer fun that we know young adults often need for their social aspects.
That's right.
So those are some great examples. Is there another community member that would like to share a few of their strategies that have been effective, or things that they continue? Okay, I'm seeing in the chat box that Rebecca has service alternatives. So rather than asking the youth to re-engage with providers they've used in the past and have a bitterness with or not related to their provider, but the establishment that sets them apart from typical youth. Okay, so it seems like they have some opportunities. So instead of going back to the system and or the organization that might not have met their need for whatever reason, but that they have some opportunity to connect with other offerings that would be available to them that is driven by them. So that youth-driven, person-centered approach is definitely important. You also mentioned a little bit about the past and some perhaps bitterness. We often hear from young people that trust is important, that when trust is broken, it is really hard to reestablish the relationships. And so we know we need to honor that, and trauma-informed practice is really crucial to help with rebuilding trust within engagement. I'm seeing some other suggestions in the chat box. Lacey mentions that they're offering some leadership positions for youth, having tangible opportunities to be involved. Beginning is something found helpful for youth buy-in. So really getting them involved not only in the treatment and or the services, but other kind of aspects of programming and leadership. Oftentimes we see that young people are more excited to do leadership, and then through leadership they realize maybe I need a case manager, or maybe I need a therapist. So it's a lovely way to also get them to access the support and services. So I just want to thank you all. Sure, we could brainstorm a bunch of successes that you're all having, but I want to give an opportunity for us to hear from some of our guest presenters from our communities. So I want to turn it over to Kentucky to jump in and share a little bit about their work.
Hi, this is Kate Tilton, and I'm the project director for our Healthy Transitions grant here in Kentucky. And I'm here with Stephanie Sykes, and she is one of our youth coordinators here in Kentucky with our grant. Our grant is entitled Tailored, and our focus has been on increasing access to services and supports for transition-age youth at our sites. And the way we've gone about this is to open drop-in centers in our state, and as has been discussed, low-barrier drop-in centers. And you can look at our website at www.tailored.org, and Tailored is Taylrd, if you want to see some pictures of our drop-in centers. But today we were asked to share some of our engagement strategies that we use when we are working on getting young people to come in to the centers and keeping them coming back. So I'm going to list a few of our main engagement strategies, and then Stephanie is going to talk in depth about some of our core strategies that we use. So just listing out and talking about some of the things that we do. Our number one is really involving young people at all levels, and so whether that's in the program or at different levels within the system of care involving young people around the table. Another important engagement strategy that we use is providing youth peer support specialists as a core service and in the drop-in centers, and making sure that the peer supports are easily accessible and are the first service that young people are able to access, rather than them having to jump through a bunch of other hoops to get to the youth peer support specialist. So another engagement strategy that we use is providing spaces and services that are developmentally appropriate for young people. And this is really a big area. It encompasses quite a few things. One of those is focusing on the goals that the youth identify, and like Bree had mentioned earlier, a lot of times young people coming into the centers, their goals really aren't, I need help with my mood disorder, it's I'm hungry, I need to get a job, I want to get back into school, and so we focus on those first, and as Bree had mentioned, many times that will then lead into talking about behavioral services and supports that they would like to access due to symptoms interfering with their ability to meet those goals. Another area within providing spaces and services that are developmentally appropriate, we make sure that young people are helping to co-design the spaces. So we have 4 drop-in centers that are pilot sites, and then we have expanded into some other regions. And although our 4 original drop-in centers are our 4 original drop-in centers are not within the mental health clinic. Our expansion sites, some of those sites do have their drop-in centers in the mental health clinic. It's an area. So we make sure that young people are part of designing what that space looks like, how to create a space that is youth-friendly and welcoming to them. And then we also make sure that services and supports are easy to access, that young people can access those services and supports that they identify quickly. And we feel like that's part of just the developmental needs of this age group is if they indicate that they need something, you need to kind of jump on it. They can't wait 3 months to see that doctor. So we've really worked to try to create one-stop shops for young people and make it so that they don't have to jump through all of these hoops or meet the strict criteria to be able to get the services that they want. And maybe finally just making sure that the space and the services look and feel different than maybe what they have experienced in the past. We have a lot of young people that come in that have system fatigue, that were some of those folks that ran from services when they turned 18, so we want to make sure that things look and feel different. And Stephanie, you want to talk a little bit?
Yeah, so I want to speak a little bit more to how we've involved young people at all levels. With our Healthy Transitions grant, it provided us some capability to really hire people on. But before that, Kentucky had a youth council that consists of 18 young people, and that is a youth move chapter now with lived experience. And then that was mostly in Kentucky that came out of the behavioral health initiatives to expand youth voice. But then we saw other systems like DCBS and child welfare and juvenile justice attempt to make youth councils as well. So we had a lot of interest before our grant started in expanding youth voice and youth engagement in our state. So we've been very fortunate in the fact that we had the environment that was welcoming to this whole idea. But our grant has hired youth coordinators at the state level, and Healthy Transitions grant only require 1, but I think early on our project director and our PIs recognized that we would need multiple people because of our state's geography. It's so long, and that we need more than one of us to help kind of cover this whole initiative. Then we decided that it would be a good idea to hire local level youth coordinators as well. So we have youth coordinators in the local communities. And as Kate was talking earlier about some of our expansion sites that aren't directly covered in the grant, they have kind of adopted this idea. And as they're hiring youth peer support specialists, they're putting some of them in more youth coordinator roles because they recognize that having young adult leadership in their programming is really, really important because, they're able to access them daily and they're involved in everything. So Kentucky's kind of top-heavy is what we talked about, in the fact that we have a lot of programming and policy involvement of young people, and it's kind of rained down. So we've really started to work on that community and individual level of engagement, or youth engagement in the state. And another thing I wanted to mention, though, I think the article that we read, the first homework assignment, especially talking about those domains of, or the continuum of youth engagement, if you look at that, I think it's a very useful tool, because if you hire just like one youth coordinator, or you rely heavily because you found your star youth, you'll often see that the young person burns out and exits very quickly, and I think we have seen that happen in the state sometimes because they feel like a lot of pressure's on their shoulders. So paying attention to that and being mindful as we've been hiring young people and learning how to support them has been very useful.
And then, Stephanie, did you want to talk a little bit about how we've included young adult staff in data and evaluation?
Oh, yeah. So that's a little extra piece, too. I think it's important that our evaluation staff, too, and our data people here in Kentucky have recognized that maybe youth are not as disinterested in data as it seems to be. I think they always have kind of gotten the bad end of things, and they feel like the public thinks data is boring. But what we found is a lot of our young adults are really interested in data, and through that, wanting to build their own skills in professional development, we have been able to engage young people in that process. So especially the young people we've hired, we have been able to train them. And I am, as a youth coordinator and a person with lived experience, have office hours with our evaluation staff. So I'm dedicated at the state level. And then we co-designed a training to train the young people at the local level, and then we went and co-trained. And then both of us are available for coaching ongoing for that. And setting up that system, I think, has been really useful, because we see that the young people in the centers are now getting invested, and the people we're delivering services to, our young people there, are getting invested in the data that we're collecting and popping back suggestions, and data is just becoming more useful because of that.
So we also wanted to share a few of the challenges that we have faced regarding engaging youth with our Healthy Transitions grant. And again, I'm going to list a few, and then Stephanie is going to talk more in depth about some of the big ones that we have faced. So one has been buy-in from agencies, from policymakers, that young people have some specific and unique developmental needs around behavioral health supports and services, and trying to help people understand that traditional mental health services don't always work for this age group and aren't always appealing. So that buy-in piece has been challenging. And then also the buy-in around the value of youth involvement and voice, and that young people really need to be equal partners around the table, that we need that authentic voice and that authentic involvement, that if young people come to the table, that they have an equal say. They're not just there to kind of chime in and we'll take the ideas or not take them, that they're a member around that table. Another challenge that we have had is turnover. So turnover with our youth peer support specialist staff and other folks at our drop-in centers, and that also relates to our training gap and coaching issues. So getting new folks retrained in everything that they need to, and then just the need for more training when people don't have the time to do, gobs and gobs of training when they're staffing the drop-in centers. And then we've had ongoing discussion and planning and trial and error around coaching for young adult staff, whether it's the youth coordinators or the youth peer support specialists. And the direction we've got is that supervisors really shouldn't be the coaches for young adults, but identifying who the coach should be within the organization have been challenging. Another challenge that we've had is really system culture and the inflexibility of a lot of systems and agencies. So we are still quite siloed, and a lot of the mental health agencies themselves are very siloed within their agency, and so that has been a huge challenge. And then, of course, financing issues as we move into really getting to work on sustainability for our programs. Finance issues are complex and large. So, Stephanie?
Yeah. So as we were talking earlier, we realized a lot of these issues do tie into that system culture and inflexibility. As all of us know, because we work in systems, if things have been running a certain way for a while, and it can be hard to contemplate change, and it can be hard to implement it. So one huge example we have of this, and at the different systems we work at the state level, is helping to educate the systems at the local level that their young people are going to want to communicate and access services through different communication systems. And I know that we were reading that in some of the homework, but, you know, people want to talk to their peer support specialists via text and Facebook. However, agency policies for a long time have been, oh, no, we don't do that, HIPAA violation and all those things. So one of our communities was actually pretty easily able to get a meeting with their CEO and their upper-level management and I would say, pretty quickly get that policy change. It took a little budging, but it was fairly quick. Another agency we see originally was able to, but as they've gone through some changes, some things have happened, and they are having more of a challenge getting that policy changed. They have had a more difficult time reaching out to young people and a more difficult time engaging young people because of the way that they're being able to communicate because of constrictions put on them by policy.
And we've seen, especially young people in crisis or homeless or have fragile housing, a lot of times the traditional means of communication are not going to work for them, that they need to be able to communicate through Facebook messaging, texting, some more flexible means of communication. So to wrap things up, we did want to share some resources that have been helpful to us here in Kentucky. And one is, if you're familiar with it, the Inventory of Adult Attitudes and Behavior. This is something that Lacey Kendrick brought to us.
And she's on here. Hi, Lacey.
And it has really helped our systems kind of look at where they are as authentically, involving youth and understanding it kind of in a deeper level past just, sticking people around the table.
And when we accessed that tool, Lacey did a great job of modeling for us how to administer that and having more open discussions, and the facilitator kind of being vulnerable and letting us see that they're not perfect either. And I think that really facilitated a good conversation around that.
And then Youth Move National has been a huge support to us, especially around the youth peer support position, also helping people understand the difference between youth-guided, youth-directed, youth-driven, just a lot of support from them. And then our drop-in centers, we modeled them off of the Youth Move Oregon drop-in centers. Ours look a little different, but they have been a huge help to us. And then Pathways RTC has been a huge resource and help to us as well. And that's it. So if anyone has any questions for us.
Yeah, awesome. Kate and Stephanie, thank you so much for sharing so much of your knowledge and experience. We have time for one or two quick questions from our participants, if you have anything to ask Kate or Stephanie. You're welcome to throw a question into the chat box or to unmute your phone and be brave and talk to us. Okay, I have one question for you, Stephanie. Both you and Kate spoke about involving youth at all levels, and I think you gave some really great examples of the Statewide Advisory Council and the hiring of the youth coordinators at the state level. Would you give us an example of what youth engagement looks like within like the drop-in center? Just give us a taste of what that might look like on a given day.
So when a young person walks in, and you're talking about like the service level, right? The individual receiving service level.
Yeah.
Yeah, okay. So when a young person walks into the drop-in center for the first time, their first point of contact is a peer support specialist. And it's not like a person sitting at a desk, they're standing up, they're there. So I think that is like the first thing that intentionally engages them in an environment that says this space is for you. So that young person is then connected with another youth peer support specialist that's usually in charge of kind of like introduction. We have kind of like a system where they fill out an emergency contact form and kind of are like given a tour of the center and like told what it's about. They sign, of course, an agreement just to say that while they're in the center that they're going to respect the rules and all that. And eventually they'll be engaged in membership. And it's just kind of like, it's a fun space, and because it's fun, there's a pool table and a comfy couch. Those things, even though they seem like a rec center, it's more like tools that our youth peer support specialists can use to engage that young person in conversations about how their life is going and what is bringing them there, really, in more of a casual way. Does that answer your question?
Yeah, that's great. Thank you. There's a couple more questions that came in via chat, and we have just a couple of minutes to verbally respond, and then if you guys are willing to chat some responses, we'd love that too. Lacey's wondering about a recommendation or a lessons learned from your experience with coaching.
We're still trying to figure it out. So.
Yeah, so there are a lot of lessons learned. I can tell you, like Kate mentioned earlier, that one thing we've realized early on is you cannot have somebody who is in a supervisor role nor in an oversight role be a coach. Now, I can go to that person for coaching, but it's more over professional development issues and less over, I think what a lot of young people with lived experience becoming professionals run into, like, okay, I'm struggling with my wellness and I need to talk to a coach about how to navigate that in a professional setting, really. So we're still trying to figure that out for sure.
Okay, cool. Well, I think that even that recommendation is helpful.
Yeah.
Right? Yeah.
Yes. Thank you. I'm glad.
Okay, it's like the popcorn response to discussion questions here. So Marianne's asking, how do you guys engage with disengaged youth in your area?
Well, and I think what we would say, a lot of the young people coming in to at least some of our centers, half or more have interfaced with their mental health center at some point in their life. So I would say a lot of those young people are disengaged because they were at some point connected with the mental health center and then disengaged. So the engagement is just offering them a different way of providing services and supports and more on their terms and in a comfortable setting.
Yeah, and outside of drop-in center hours, our staff isn't just there for drop-in center hours. So a lot of them, they go out in the community and they meet them where they're at. So you have a lot of our local staff, they go and attend events at the schools, and they're setting up booths, and they're engaged in other community meetings to kind of spread the word about what we're about and how we're different. And I think that really does pull in a lot of those young people who have been engaged before, then left, and now they're ready to come back.
And then I think we really want our centers to have more flexibility with texting and Facebook instant messaging, because then the youth peer support specialists can check in with young people they haven't seen in a while just to say, is everything okay? I've been thinking about you and wanting to make sure things are going all right with you. So that flexibility.
Great. Stephanie and Kate, thank you so much for joining us and sharing all of this. Questions are continuing to come. If you're able to monitor and respond in the chat box, I'd love that. And for everyone else, we have more great grantee perspectives to share, and I want to make sure that we get to hear from everyone today. So a big thank you to Kentucky and Taylor. And we're going to, I'm going to transition us into a next conversation. Please note that the slides are available in the download file, and there are resources on those slides that we're not going to have time to talk about. So go ahead and download those and think about those as a learning tool after this webinar. Consider this set of questions. These are your homework questions to the second resource that was set out. Please consider taking these questions back to your team to work on within your community. And I am really excited to introduce Susan, the Executive Director in Youth in Mind, and also working with the Bay Area Trauma Systems of Care grantee in San Francisco, California. Susan, welcome, and I'll turn it over to you.
Hi, thank you. I'm excited to be here. Again, my name is Susan Manzi, and kind of my connection to systems transformation really actually started at birth. I was born into the child welfare system, and I was in and out until I aged out at 18, and really kind of my saving grace was getting engaged in youth programming, getting engaged in community-based organizations that really taught us like education, skill building, and supported us partnering in the change models. Some of those organizations, they'll be California-based because that's where I'm from, but some of those organizations are the Youth Training Project, the California Youth Connection, really powerful organizations that would work with young people that were systems impacted. And they taught us to be facilitators, to engage in local to state and sometimes even national change opportunities. And as I was kind of growing in that movement, there was a cohort of us that were really engaged kind of during child welfare reform, and we were starting to work in programs and agencies, social work training academies, health and human services, and we felt like the number one reason why we were engaged in child welfare in the first place was the unmet mental health needs of not only ourselves but also our families and communities. And so we broke away, and we literally were young people that had created a nonprofit, the youngest being 12 that was on the first board, and also the eldest being 28. So that's kind of the powerful thing about Youth in Mind, is that it really does come from the grassroots. It really does come from young people that really designed and delivered this organization. We were a coalition for nearly 10 years before we transitioned into a nonprofit 5 years ago. We're still California-based. Our tagline is that we build participatory leaders in mental health since 2004. And our key focus is really around building the education and advocacy skills for teens and young adults impacted by mental health. So I was asked to come here to really talk about sort of our youth design theory of change to promoting youth engagement. And really like what some key strategies with our practices when we're working with impacted communities. So I would say that we take community voice and choice seriously in all of our programs and policy decisions. It sounds like some of the other partners and even the opening and some of the homework assignments speak to that clearly. And we do this on two main levels. First, organizationally, we have a leaders cohort, which has its own leaders board that is directly connected with our staff and also our board of directors. There are liaisons into our youth participants, and then surrounding that to sort of cultivate additional leadership capacity and engagement to the leaders board, we have a leaders cohort which sort of talks to some of those really like low risk engagement. And we worked with our leaders board to be able to really create kind of our own theory of change, and that theory of change is that we YIM listens, acts, creates, and gives back. And so when YIM listens, we spend a whole year visiting minimally five key regions of California, because our state is very large, it's very diverse, not just with communities of color. There's a big LGBT presence, and there's also really like from rural to very inner city communities. And so we've designed a facilitated process to really have listening sessions and pull from those oh, sorry, I thought I was hearing some feedback. Is my sound okay?
Susan, your sound is good, but we'd like everyone to check and make sure your phones are muted. We are hearing some background noise from someone.
Okay, good. So we spend all year doing that every odd year, and we take and collect that stakeholder feedback, and then we direct our every even year, like what our program activities will be based on whatever the needs are throughout the state. When YIM acts, it's really creating opportunities for engagement for our young people to be able to engage in sort of community education, but then even policy transformation, which I'll get to in a little bit. When YIM creates, we're sort of pulling from the needs of young people throughout California and really creating other opportunities, such as our young people interview other youth and they create podcasts and we'll teach them the skills and sort of support and coach them in creating those podcasts so that there's ways for other young people to really hear about like what is mental health, what are our barriers to be able to access supports or treatment, what are different models for prevention, especially from community sort of notions of health and well-being. We also create quarterly zines so that young folks can really be able to share their stories, their artwork, really express their talent and sort of lessons learned. And then our leaders board actually goes to and does visits, like wellness visits to drop off wellness kits, the zines, maybe share the podcast and like host different discussions on that. And then when YIM gives back, it's just thinking about how we actually, whatever we fundraise, because we'll do grassroots fundraising for this with our young people, and they'll go and do visits at treatment facilities, jails if they're really directly connected to strong relationships where they might be able to pass around and try to be able to collect stories for the zines, or just even giving different handouts to say that when you're out of hospitals or you're out of jails, you can be able to connect with us, and we'll have a wellness kit for you. We'll have wellness scenes so that you can really be able to connect with that shared experience. And then kind of getting deeper, so that's sort of the YIM listens, the YIM creates, the YIM acts, and YIM gives back is really our theory of change. However, our key programs that we really work with our leaders cohort, there's three. There's wellness mapping, there's building leaders, and collaborations work. And so wellness mapping is really around, we have wellness build workshops. A lot of our wellness mapping is really focused on even some of the 8 dimensions of well-being. And we break that down into 3 different categories. So building the basics, which is all around the physical, intellectual, and environmental well-being. Build the social, which is the emotional, social, and spiritual well-being. And build the business, really talking about financial and business health. And also, if you're familiar with Maslow's pyramid of human needs, these build the basics, build the social, and build the business also fit really nicely within sort of that safety and stability and physiological needs, really talking about self-esteem building, confidence building, love and belonging, and also within self-actualization. Once the wellness mapping is really effective for just working with schools or going to other community-based centers. We do a lot of even like wellness barbecues where we might have skill building opportunities, but just to build kind of awareness and engagement. And then when young folks really want to get kind of more involved, they'll start going through our Building Leaders series, which teaches a lot of young people about facilitation, training, even sort of strategic action planning. And then when folks really start getting seasoned and they want to engage in the systems transformation process, we'll have a policy build series that will really talk about what is policy etiquette, what is governance, how to be effective leaders, to be able to partner with systems. And that leads me into collaborations work. And we sort of have 2 pathways under our collaborations work. We always have design and debrief sessions with our partners if they're interested. We also have assessments on just how leadership, like youth leadership ready they might be. And then that helps us really decide, like, do we have more of a supportive collaboration, or do we have more of a strategic collaboration? And some of our supportive collaborations might look like if there's absolutely no young people at committees or decision-making tables or engaging in sort of a leadership development model, we may actually come in and sort of support reaching out, doing the engagement piece, just really being sort of that outside partner to support in ways that perhaps agencies can't do. Like I was hearing a lot about some of the HIPAA issues with social media connections, and I really hope in the future that we can like fix those that red tape, because it is true, like we're in a technological era and young people communicate so much through technology that's a huge barrier. But being a nonprofit, sort of doing partnership, we can be able to, have private Facebook groups, or we can Snapchat, or we can connect through even tech apps that might be able to have like a big string of groups to send reminders, support in the transportation. And then if agencies are really sort of developed and they're really engaging young people all the way from just entry-level engagement all the way to staffing or governing bodies, we might have more of a strategic partnership with them, which could be like we train the trainers with other organizations. Sometimes we co-design curricula that might be able to customize to their local community or agency needs. I also want to kind of go back to some of these like more micro behaviors of engagement that we were talking a little bit about like how do you bring food, or how do you support transportation, and we sort of going back to those 8 dimensions of well-being, that really responds to communities that are traditionally unserved or underserved, to just gain awareness and access to build community mental health, both individually and collectively. And we do that by even setting our agendas on build the basics, so and build the social and build the business. So for example, with build the basics, since that's around physical, intellectual, and environmental well-being, we always start our meetings off with a wellness wake-up, some type of energizer to really get our bodies and our minds moving. And then with intellectual and environmental well-being, we might have some type of critical thinking question that may pertain to the environment or sociological or even political influences that might be impacting their overall health and well-being. And then when we get to build a social, we start to program in different community and mindfulness building time. So that could look like, depending on the youth community that we're working with, that may look like anything from doing martial arts to doing team builders and energizers to meditation, but just really thinking about that time for people to socially connect and also just really check in with their bodies and their mind. And then build the business around financial and business well-being, we really put in the educational and skill building portion, and it gets a little more academic. We really always think about this being trauma-informed when we, no matter what type of event, if it's like a big workshop or a conference or a summit, or even if it's just a committee meeting, we always have food, we always have music, different activities to really make experiential learning high and sort of break that ice with other people. This may seem kind of weird, but actually there's brain science says that don't ever start a meeting before 10 a.m. Just because developmentally minds are still growing and they're really not awake. So if we're trying to get folks to meetings that are before 10 a.m., there's not high success. And we think about like how to, we absolutely 100% always stipend We stipend at $25 an hour, which sometimes can be higher than what other folks might do within their agency, but we sort of set this standard to really think about empowering young people around financial wellness, or even our hope is that when they might be working with other programs, they can start really speaking up about if they come in to do public speaking or if they're engaging in other committees, that they sort of have a baseline to really know about, does this mean I'm a stipend volunteer? Does this mean that I'm an independent contractor? And what type of rate can I do, and what type of calculation or even formula for that? And I think the other big thing that that we do, which some of the other partners have also talked about, that is that it doesn't matter if it's a meeting or if it's a very large program. Our largest program is a week-long conference. We always have immediate feedback, whether that's through evaluations, whether that's through like just even facilitated group feedback, so that young people can really see that their voice and some of their actions have some type of impact, like either like on paper where they can be able to share those changes, or even in sort of larger group feedback, so that we literally will customize like our workshop based on their feedback. And that's huge, because I think oftentimes when we are system survivors or we've been engaged in services, we haven't always had sort of that opportunity for voice and choice in programs or larger policies. And so even that kind of what we call a micro behavior of empowerment, the next time that a young person comes to one of our meetings or our trainings, they literally will see like, oh, I asked to like be able to move out into outside to be able to do this activity, and we're immediately putting those results into action. All the way to like if they're on our leaders board, we also teach skills around participatory evaluation. And so for folks that will start staying engaged with us, every 6 months we also do a psychosocial well-being measurement. And this was made in partnership with our leaders board and also student interns at University of San Francisco and also Mills College. And so we really wanted to think about, like, is the work that we're doing improving, lives individually across California? So it starts measuring things about identity development, confidence building, social connectedness. So in closing, some of the key takeaways are just really ensuring that when we're thinking about programs to policies, that we're building in the education and skills into all work that we do, and that we're really ensuring that there's participatory community models in our organizations and our governing bodies. I'll kind of close there because I know we're a little short on time, and I wanted to leave any opportunities open for question and answer.
Thank you, Susan. Let's see if we have just a couple minutes for one or two quick questions on the phone, and then we're going to ask you all to follow up with additional questions in the chat box because we want to be sure and get to hear from Florida as well. So anybody have a question for Susan? So Bree asked in the chat box, Susan, are you able to share the psych and social tool you all utilize?
Yes, I can share that. Can I just email it to you, and then you can send it out to the group? Okay.
That's great. If you'll send it to me, I'll put it out on our everyone that registered for this webinar. Okay. So that was terrific, Susan. That's so impressive. We really appreciate you sharing all of that with us. And please continue to pose questions to Susan in the chat box, but we're going to go ahead and move to Florida, I believe. Gwen?
We are going to move to Florida, and thank you, whoever's advancing the slides. So I'm Gwen White, and I'm one of the co-facilitators along with Johanna, and it's my pleasure to introduce to you Tanisha Freeman Foster and Caitlin Diana from the Florida Healthy Transitions Grant, Florida Youth Transition to Adulthood. And I'm going to turn it over to you two, Tanisha and Caitlin. Welcome.
Thank you all. Good afternoon, everyone, and we will be brief because I know we're running out of time. Some of the things that we have done to enhance our program is our first strategy was to work with our local 211 agencies. So our 211 agencies are the hub and the front line responders for our Healthy Transitions Grant. That those agencies provide services 24 hours a day, 7 days a week. They provide assistance through text messaging, phone calls, and also email. And so people are able to call them. They serve as a resource to link people to services within the community. And also they provide suicide intervention and suicide prevention services as well. And it also allows for our staff to be able to actually turn off at the night and on the weekends, and the 211 staff, which we have staff that are funded by Healthy Transitions in those facilities. They provide services and also follow up to the direct service agencies and providers there. Some of the things that we have found to be successful with in our program is we found that we must have enthusiasm and support from our CEOs and senior level managers, and we have that at all of our, we call them innovation stations instead of laboratories. All of the CEOs and the senior level managers are excited, and they look forward to hearing about healthy transitions. They're asking about healthy transitions, and that's important because we know that there's a trickle-down effect to the other staff. So if there's excitement from the top, there'll be excitement at the bottom as well. Also, 80% of our staff are young adults themselves, so we intentionally sought to hire youth and young adults, because what better way to have youth and young adult voice is to bring them on board, because they are able to talk to us about the trends. They are able to tell us what is cool, or that was last week or last year and it's not important anymore. So we rely heavily on our youth and young adults, and we have youth and young adults employed at the 211 call centers. We have youth and young adults employed at the direct service agencies as youth coordinators who serve at the local and state level, also as peer support staff, and transitional specialists also, which are our case managers. We also have our young adults involved on our local evaluation team meetings and throughout all aspects of our program. Also, holistic health approach is very important, because we know that a majority of our calls that come into the 211 center, most of them are calling about a food pantry or financial assistance. And through assessing them, we learn about their mental health challenges or their substance abuse challenges or challenges with family or child welfare involvement. And so through screening, we're able to determine their risk and the resources that they're in need of, and if they are a good fit for healthy transitions. We have also adapted the GAIN short survey, the GAIN SS, based on our partners in New Mexico with the Healthy Transitions program there. We borrowed that idea from them, so we are using also the GAIN SS so we can learn more information about the callers and young adults and youth, and determine if they are just in need of that food pantry or if they're in need of more in-depth services. Also, I think one of the things that has been really good is making sure that everyone comes together. As far as referrals, the 211 agencies and our direct service providers meet at least on a weekly basis, and they talk about referrals. They have team meetings, and everyone comes to the table together. They're facilitating meetings at each other's agencies, and people are really getting to know the program in depth, and they're also able to say, okay, this young adult is enrolled in Healthy Transitions. They called 211 last night, and they were in a crisis situation. So everyone is on the same page. Everyone is informed and up to date about the participants and what is going on. Also, involving the youth and young adults in changing the name of our program. Initially, we had Florida Healthy Transitions, and the feedback was that that is too sterile and it sounds like something from the medical field, and so we changed the name to include Bent Not Broken, which is our tagline. And if you all were at the conference, you might have seen some individuals with our shirts on with the tree and Bent Not Broken. And so we talk about resiliency, we talk about weathering the storm and bouncing back. One of the other things that we have implemented recently with our 211 call center is that initially, once a youth or young adult was identified as being eligible for healthy transitions and being a good candidate for the services, they were referred over to the direct service staff or to our youth coordinator. And what we found is during that referral, they would fall in between the cracks because they would not answer the phone, or they would answer the phone and say, oh, I just needed housing, I don't need these services. So what we have found is that with 211, once that young adult or that youth calls in, 211 staff will work with them. They will help them with housing. They will help them with other services that they are in need of. And once they are ready and they have worked with them and provided them with information on healthy transitions, once they're ready to receive those services and at that place where they can be receptive to those services, there's a warm handoff to our youth coordinator at the direct service agencies. And we found that to help tremendously with engagement, because now just about 100% of the youth and young adults who are referred from 211 to direct services are engaged in care. We're also finding that initially youth and young adults were calling and they were more interested in our weekly wellness groups. And now I think through social media, through community outreach and advertising, billboards, television commercials, we've been able to increase awareness and decrease stigma. So more youth and young adults, they're calling now and they're specifically requesting case management services. They're requesting more intensive services. So we're really excited about that. I will turn it over to my youth coordinator, Caitlin, who is on the phone to talk about her role and that process once the participant is handed off to her.
Thank you, Tanisha. Hi, I'm Caitlin Diana. I'm the youth coordinator for the Healthy Transitions in Pinellas County. So we also receive referrals from my agency internally, and I conduct outreach at high schools, colleges, DJJ, foster care agencies, and local community events, which also spreads the word and awareness about the program. So I contact all of the referrals within 24 hours. And unless it's late on a Friday afternoon, I can't get to it, then I'll call them back to Monday morning. If the youth or young adult doesn't answer, then I'll leave a voicemail indicating that they can either call or text me back, because some of the young adults don't like to talk on the phone, so some of them will text me because they prefer that. And I make it clear that meeting with me isn't committing to participate in the program. And I think the verbiage that we use is really important, so I don't call it an orientation or an intake. I just say that I'd like to meet and just talk about the program and answer any questions they have. And I let them know that I can meet them wherever they feel most comfortable. So some of them haven't received mental health services before, or some have had bad experiences, so they don't feel comfortable coming to a mental health agency. So I can go to their house or meet them at like McDonald's or a park, wherever they choose. And I think what's also unique and beneficial to Healthy Transitions is that it's required for my position in being a peer specialist to be 18 to 25 and have lived experience. When I go and meet the young adult, they're usually pleasantly surprised to see that I'm young in their age. And I also emphasize that the services that they receive is completely run by them, which helps with engagement. I tell them that we aren't here to tell them what their goals should be or what they need to work on. and this is consistently emphasized by all of the Healthy Transitions team throughout their time in the program. The young adults are encouraged to choose what they want to do or discuss in our weekly wellness groups, which I facilitate and organize every week. And groups are from 5 to 7 p.m. to try and accommodate the young adults who are in school or work. And I'm planning on starting an additional group for those whose schedules conflict with the current group. And young adults can choose to be in the intensive case management component of our program, which implements the wraparound treatment process. So we also reiterate to the young adults that their voice and choice determine what their needs are and what their monthly wraparound goals will be. And as Bree discussed earlier, there could come a time when the young adults might feel they don't need our help anymore, so it's really important for the young adults to know that they can contact myself or 211 if they change their mind and want our help or other services in the future. Any questions?
Awesome job, Caitlin.
Thanks.
I think we've, in the chat box, there's been a lot about some of the trends we've seen across all the presentations, like means of communication that are young adult friendly, so they can pick up a phone for 211 or go to the drop-in center or participate in wellness opportunities. The key of administrative support and understanding of this age and stage. So any questions or considerations for Tanisha and Caitlin?
Hello, guys. This is Francisco again from Lawrence, Mass. I have a question. So, is the 211 call center you guys have? Did you guys create that, or did you create it, and how did you guys do that?
Great question. So our 211 call centers exist throughout Florida, and I think they exist in other states as well. But here, just about every county has a 211 call center, and what it does is that wherever you're at, you can pick up your phone and dial 211, and it will ring to the call center that's in the county that you're in. They do crisis services. Our 211 that we're working with, we have a huge bridge here called the Skyway Bridge. There are blue boxes on that bridge, so if someone is considering jumping and taking their life, they can pick up that phone and dial the number, and 211, that's their phone, and they respond to those calls. So they're already in existence here. They already provide crisis, intervention, prevention services, linkage to community resources 24 hours a day, 7 days a week. What we did with Healthy Transitions is we brought them on as a partner, and we fund 1 to 2 to 3 positions there. We fund a care coordinator there, and in one of our centers we also fund intervention coordinators there as well, intervention specialists who are the frontline phone responders in those agencies. So we brought them on as a partner, and we specifically identified a position there so that we could have that person participate in the staff meetings, participate in the agency meetings, and it would still be a part of their ongoing services, but we wanted to make sure that that person would be allowed to come to the table and participate in meetings and really become engaged in the Healthy Transitions program.
So, Tanisha, the service already exists. It's statewide, but your creativity, your add-on was partnering with the crisis line and providing them some funds to hire specific people to work with this age population.
Correct, to hire young adults to work with this population, yes.
And Lacey has typed into the chat box the National Crisis Text Line. we're under, she points out 80% of the users are under 25, so that's something to keep in mind. And Aaron's told us about 211 in North Carolina. I think the sort of thought for replication is, where are those partnerships already doing some of the things you would like to do with your young adult population, that you can be creative about working together. And I did hear both Caitlin and Tanisha saying that it's not just that you fund a position, but those positions are continually a part of your team and communicating together.
Mm-hmm.
Okay.
And our saying here is that once you met 1211, you've met 1211. So I see someone said that North Carolina has one as well. They are all different. We have different ones here. We have some that don't do any crisis services. So it really depends on the area. That's all.
We are at 3:30. You can see, and thank you very much. I interrupted you, Tanisha. I apologize.
Oh, no problem.
So we are at 3:30. I think that you can continue to see we have comments coming into the chat line. Here you have dates for the continuing our learning community. We appreciate everyone who are peer presenters, but then all of you who have participated as listening learners or as participants in the chat box. And here are contact information for myself and Johanna. And I believe, Colin, will a feedback form be coming up after people get off?
Actually, Gwen, if we could pull up one more polling question, we could do that.
Fine.
Right
I thought perhaps with your moving the slides ahead, we were skipping it. Colin, one more polling question. So this is our feedback form. Please fill this out. You will see that there are 2 questions, or 1 question, and we're looking at the feedback. No, there are 2 questions. I will say, as people are filling this out, that Johanna and I are always interested in any feedback you have for the learning community and how we proceed. So we did have up there our email addresses. Please let us know your thoughts. And it looks like we don't have other people doing that. So you have, okay, there, Johanna has put her address in the chat box, and I hope you all have lovely afternoons. Thank you for spending a portion of your day with us.